Good morning and greetings wherever you are in the Eastern Caribbean Currency Union and around the world. This is ECCB Digital Dialogues, a public engagement series specially designed for you as we navigate this pandemic together. Today's dialogue is our 13th edition, and our topic today is pandemic and healthcare. On March 11, 2020, the World Health Organization declared the COVID-19 a pandemic. 13 months later, we are still dealing with the effects of this pandemic. Here in the ECCU, we've already lost 112 persons, and worldwide, over 3 million. Sadly, as yesterday, the pandemic continues to rage, and in some countries, it's actually on the rise. In addition to that, there has been massive socioeconomic fallout, and many people are experiencing real economic hardship in this period. The ECCB extends its heartfelt condolences to all those who have lost loved ones in this season, and also recognize the anguish, the pain, the suffering of those who continue to have economic difficulties in this period. And of course, we assure you of our support, ongoing support, as we navigate this period together. If you're interested, you can track the COVID-19 situation as well as the rollout of our vaccine program in our islands, in our member countries, on our Facebook page and on our website. We have a tracker that is daily, and you can see what is going on there. So what is the likelihood of more pandemics? How have our healthcare systems fared? What should be the priorities for our region in respect of healthcare as we move forward, drawing on the lessons of this pandemic? Well, these and many other questions will be addressed by our eminent panel, which I will introduce shortly. But first, some housekeeping announcements. This dialogue is being streamed live on our ECCB Facebook page and our YouTube channel, ECCB Connects. Attendees in the Zoom room will have their microphones and cameras muted and turned off respectively throughout the proceedings to ensure the smooth flow of the dialogue. Attendees are invited to submit their comments in the chat box and their questions in the Q&A box. I repeat, comments, chat box, questions, Q&A box. And so the moderator will read out those questions and to the panel. We also have a colleague from the ECCB monitoring our Facebook page, and our colleague will send the questions through to the Zoom room so that the panel can also field those questions. As always, we welcome and we request a respectful dialogue, and you should also note that the proceedings of this event will be available both on our Facebook page and our YouTube channel after this event for your viewing pleasure at any time. If you experience any technical difficulties during this event or this broadcast, we simply ask you to reconnect using the link provided. We are opening our audience poll from now. As you know, this is a very important feature of our dialogue. And so you will have an opportunity from now to answer the questions in the poll. So if you need to check out early, you can do the questions before you leave. And so we will go to the Mentimeter, and the code today is 50351947. So let me just repeat. If you're new, you simply go to your browser on either your smartphone or tablet. You type in www.menti.com, www.menti.com. The code today is 50351947. And once you've done that, the questions will appear and you can answer them. And so I want to thank you very much in advance for your participation. This is a very important segment in terms of feedback from our participants. We're very pleased today, again, to have several radio stations and television stations partnering with us for this dialogue. In Anguilla, Radio Anguilla, Cool FM Radio, Class FM Radio. In Antigua and Barbuda, Nice FM and ABS Radio. In the Commonwealth of Dominica, we have Q95, Carry FM, DBS Radio will be at 7 this evening, so you can get that on DBS this evening. In Grenada, there's We FM, Classic FM, and Sister Isles, which is in Carriacou. In Montserrat, we have Radio ZJB. In St. Christopher and Nevis, Win FM, Vaughan Radio, and Freedom FM, and ZIZ Television will do it at 1:30 p.m. today. In St. Lucia, Rhythm FM and W Vent. In St. Vincent and the Grenadines, NBS Radio, Nice Radio, NBC Radio, Nice Radio, and We FM Radio. Again, we thank all of our broadcast partners who are carrying this event live. And now to our panel. We're very, very pleased today to have a very distinguished panel with us. And I again thank them in advance for taking the time to be part of this important dialogue. First up, Dr. James Hospitalis. Dr. Hospitalis has over 30 years of experience in public health. He's worked in several regions, of course, with WHO PAHO. He's perhaps best known in our region as the inaugural executive director of CARPHA, the Caribbean Public Health Agency. And I'm almost tempted to ask him if he knew this pandemic was coming when he decided to demit office, but I won't press him on that. Since retiring from CARPHA, he's been involved in some very interesting things, heading up a foundation, which you will hear about, I imagine, as we go along. And so I would just again like to welcome Dr. Hospitalis to the panel. Dr. Hospitalis, welcome to you. And then we have, yes, go ahead. I was waiting for you to come in.
Sorry, just unmuting. Good morning. Thank you, Governor. Pleasure to be part of this panel on an important subject.
Right, and thank you, Dr. Hospitalis. And his foundation is Earth Medic. It looks at planet health, NCDs, and he sort of brings them together in a very effective way. And we will have a chance perhaps to hear more of that. He's the founder of Earth Medic and Earth Nurse Foundation for Planetary Health with twin priorities of climate change and NCDs. Very, very important for our region. Next up is Dr. Carleen Radix. Dr. Radix is the head of the Human and Social Division at the OECS Commission that covers health, education, social protection, among others. She is a trained physician and a public health expert. And of course, you will hear more from Dr. Radix in due course. I'm simply giving you a quick bio. The details are on our website, so I won't go into all the details now. And finally, last but by certainly no means least, is Dr. Damian Graves. Professor Graves is currently a lecturer at the St. George's University in the Department of Humanities and Social Sciences. Dr. Graves is a long-standing health advocate in our region, and for some of us, perhaps best known as a former Minister of Health in the government of St. Lucia. And you will hear from Dr. Graves shortly. So that's our panel. I want to welcome them. Dr. Radix, you can come in now, and then Dr. Graves.
Well, thank you, Governor. This is quite a pleasure to be amongst colleagues, friends, and a very distinguished panel for this very important digital dialogue. So I look forward to the dialogue.
Very good. Thank you. Dr. Graves.
Well, thank you to all of you on set and all of you listening in radio land and Facebook land and social media land. It's a great pleasure to be here to articulate some of these issues, and I would say that this situation, this particular digital dialogue panel is long overdue.
Thank you very much. Very clear, as usual. And so we will now proceed. So just again, for those of you who are new, you are listening or just joined, you are listening to ECCB Digital Dialogues. Our focus today, our theme today is pandemic and healthcare. We have 3 segments. The first is the moderator posing questions to our panel. Second, we go to our audience poll. And finally, we go to our Q&A. And so the time goes very, very quickly. So I'm going to get started without any further ado. I want to start with you, Dr. Hospitalis. You have shared that there have been about 8 pandemics in the last 100 years. And of course, the Spanish flu is well known, and now, of course, COVID-19. Dr. Hospitalis, help us understand the forces that drive pandemics. What does the science say about the incidence of these global threats? How often should we expect them as we go forward? Just unmute. Dr. Hospitalis, just unmute before you jump in. Right.
Thank you. Yes, there have been about 8 or so declared pandemics in the last 100 years, which is where a disease spreads widely throughout the world in many, many countries, beginning with the so-called Spanish flu in 1918-19 that probably started in an Arkansas pig farm. Then you had, then the 50s, the 60s, flu, Asian flu. In the 70s, remember, we had HIV/AIDS, and that's not gone away. Not a pandemic, but in the 90s, we had cholera re-emerge in the Americas. And then in the 2000s, we've had SARS, which many people would remember, and MERS, and then swine flu in 2009, and now COVID. So we have a history of pandemics in the world. They seem to be getting maybe more frequent. In addition, for us in the Caribbean, WHO doesn't call them pandemics, but vector-borne diseases, dengue, chikungunya, Zika, which was called a public health emergency of international concern, the threat of Ebola. These are some of the epidemics that continue to be there. Now, what you asked about the forces, I'll comment on 4 things. First of all, human-animal contact and the destruction of nature all over the world. That's how Zika entered some of the flus through pigs, and that is a big factor. Second is population growth and travel. We used to have 25 million international travelers per year in the 50s, and now it's over 1 billion international travel arrivals per year. The Caribbean participates in that through its program, tourism, both land and sea. But that's a factor in the rapid spread of diseases from one part of the world to the other. The third is climate change. The world is changing, climate's accelerating with more heat and destruction of nature. And the fourth is the actual population we have. We have an older population. We're older than we've ever been in the history of humankind. And many people are not well. They have non-communicable diseases, which make them vulnerable when an epidemic does come along. What can we expect? Well, I'm afraid it's not good news in some ways. We can expect more pandemics and epidemics. We can expect them to be more complex. By that I mean that the infectious disease problem gives rise to economic and security and other types of problems, as we are seeing with COVID. We can expect more because of how the climate is changing. We have record heat, which makes mosquitoes breed faster for some of the epidemics that we suffer from. wildfires that drive animals from their homes to people, floods, the hurricanes that we've had, which set you up for an epidemic afterwards, the biodiversity loss, which sometimes makes way for a pathogen to emerge. So all that points to, Tim, we can expect more pandemics and epidemics, more complex ones, and we need to be prepared and resilient in the light of that.
Wow. Well, thank you for what is a very sobering overview. But I suppose the old adage to be forewarned is to be forearmed. And we clearly, I mean, what you've described is a vicious cycle of, or confluence of factors, which
Yes.
of course we need to be very, very cognizant of as we go forward. Thank you very much for that, setting that up for us so nicely. I now want to invite Dr. Radix to comment. So, Dr. Radix, healthcare systems across our globe have been inundated and frankly overwhelmed. And that's not true just for our small countries, because we've seen the same thing happen in very large and advanced economies. How prepared were health systems for this pandemic, in your estimation?
Well, thank you for that question. And as you rightly pointed out, I don't think any health system in the world was prepared for this pandemic. Although if you've been watching closely, based on what Dr. Hospitalis has said and things that we knew, we should have and could have been as a globe more prepared. But none of the health systems were prepared to deal with this pandemic. I think the advantage our health systems had in the region was first the fact that we were forewarned. The disease started on the other side of the world and it took its time to come to us. So we were able to see and learn from what was happening in other countries and to anticipate how it would come to us. Another good thing about our system is that we have strong public health systems. We believe in prevention. We believe in nipping things in the bud. And so across the region, you found that early on, there were strict measures put in place to further delay the spread of the disease into the region. And I think we're seeing the long-term effects of that when we compare the rates within the region to what's happening globally. So one of the good things about being in small island states is that for most of us, coming in to by air, where you have quick transmission, there's one port, and so it's in terms of controlling borders. And if you're coming by sea, there's some time factor there, which has a protective effect. We also have very agile systems, being one of the most disaster-prone regions in the world, having to shift, and I think it's one of the reasons why we have such a strong public health system, having to shift to respond. We have hurricanes. We know what's happening in St. Vincent right now with regards to the volcanic eruptions. Dr. Hospitalis spoke to vector-borne disease outbreaks. And so we consistently had to be agile and to shift. And I think with practice, we've been able to shift into gear to respond to this pandemic. And we've also been able to learn our health systems and in some way, and our health professionals are a melting pot of persons who've been trained from many different parts of the world and connections in different parts of the world. So managing the disease itself, or persons who've become ill and have been hospitalized, we benefit from the knowledge from many different systems to be able to manage disease. And I think that's borne out in the number of deaths compared to the number of reported cases within our region, which are a bit lower than the global average of a little over 2%. In the Caribbean region, it's around that, but especially in the Eastern Caribbean, it's a bit lower at about 1.4%. And then our public health strength is again shown in the vaccination effort. We have been able to vaccinate, at least within the Eastern Caribbean Union, close to 22% of the population on average, with going from about 10% to 40%, depending on the populations of the countries that we're talking about. And I think this is a great strength in terms of the way we're able to respond. So I think our health systems and the people within the health systems, I give my hats off. I think they've been doing quite a lot for quite a long time in the fight against this pandemic.
Right. Thank you, Dr. Radix. I don't know if I would have described our health systems as strong going into this pandemic, but you make a case for certainly their resilience, and it has to be said to their credit that we have done relatively well in managing this pandemic. So you're absolutely right about the fact that our health systems have responded under-resourced and as they are, and we have to give, of course, kudos to our frontline warriors, as I like to call them, our health professionals who have worked to help our countries manage in this period. And I want to, of course, thank you and the OECS Commission for all that you have done. You're kind of behind the scenes role, but your role is also very, very important. So I want to acknowledge that. Having said that, I will also quickly add that we have done so at considerable economic costs. And that cannot be minimized, because there's a dimension there, I don't know if we'll get into it today, which is on the mental health side as well, which is taking a significant toll on many of our people. So, but your perspective, I appreciate it, because the truth is sometimes we tend to look at the negative and not see the fact that there's value even in limited situations. And our health systems overall have responded remarkably well, to their credit. And we want to, again, give kudos to our health workers. So thank you. Let me invite Dr. Graves to join the conversation now. Dr. Graves, you've been a long-standing health advocate in our region. You've served as a Minister of Health, among other things, in academia, but also very active in the social space, public policy, the public square, as it were. From your vantage point, what have you seen over the last decade in terms of areas of improvement, but also areas of deficiency that we need to address?
Thank you very much for allowing me to join this conversation. And this is a very, very critical question that you have asked. And we have to admit that over the last decade, we have seen some strides. I think we have seen the strides in terms of health systems, or those managing health systems understanding the importance of having other people on the table, around the table, making certain decisions. As Dr. Colleen Radix has suggested, we have seen a sound COVID-19 response strategy, and she has outlined the reasons for that, so I would not go into that. But we have also seen what you call the OECS Pharmaceutical Procurement Service and Supply Chain Management, which is a model to other areas of the world, and we have to say kudos for that. We have seen some strides in our maternal and child health situation. We have seen some strides in infectious disease control and management, undoubtedly. And of course, we have seen some amount of success in an understanding and appreciation of the social social determinants of health. We have also seen some strides in the institutionalization of monitoring and evaluation, but there is still some way to go with that. And of course, policies and plans in human resources for health, I think we are beginning to appreciate that that is important, and we're beginning to turn the corner, but there's still something that needs to be done. Now, what are the areas of concern? One of my biggest areas of concern, Governor, is public funding and investment. I believe that public funding and investment are insufficient in terms of the coverage of our population, and to really meet the goal of what I call the community health, population health, but also in the individual health status in terms of individuals within the population. An average of 6% in terms of the budgets that our governments across the region configure or craft for year after year. I think we need to look more at that, because I am concerned that our out-of-pocket spending, the spending by the ordinary man and woman on the ground, there's an inordinate amount of spending on individual medical care and treatment of disease. And we have to look at that. That is a critical issue that we have to take into account. And also the fragmented investment and allocation to specific programs. And I believe that there's still too much being looked at in terms of secondary care, and our primary health program, although picking up in some form, I think we need to inject more funds there for the purpose of health promotion, health education, information gathering, and the like. I am concerned with the persistent fragmented disease-centered approach to service delivery. I think that, and I just mentioned primary health care, and also the management. And therefore there's this focus on what I call curative care. And I think that we need to look at that in some form, insufficient emphasis on the access on quality, on equity, on equality as well. The quality of care is important. How do we know that our patients are getting the care that they need and really getting the optimum care that they need? So there needs there's a need for a quality-driven culture with not just a patient-centered approach, but a person-centered approach, taking into account lifestyle issues, chronic diseases, and the whole gambit there, and not necessarily, as I said before, just a patient-driven approach. I believe that one of the biggest concerns for me would be the weak leadership management and governance structures that persist. And therefore, we're talking about promoting the governance of health in all policies, intersectoral collaboration, vital, whereby the leadership within the authority or within the ministry is an individual who facilitates that kind of partnership, and that is the new role. And so the triumvirate of the minister and the PS and the chief medical officer, in my humble opinion, is not working. The need for programs and policies to address prevention of non-communicable diseases and mental health. You just mentioned, Governor, the importance of mental health. These need to be given priority on the health agenda. Instead, we see a biomedical disease model kind of approach being employed with an emphasis on clinical delivery of services and, to my mind, ignoring to our peril the social and other determinants of health. Finally, because there's a lot, the inadequate health force situation we have to look at, either from the point of view of the migration of our nurses, and of course that has been stymied a little bit by the recent COVID-19 pandemic. We're also talking about specialities. We're talking about specialist physicians, specialist consultant physicians, if you will, but also those social scientific areas that need to partner with health in order to tackle the determinants of health. And we're talking about your health planning, your health economists, your statisticians, and so on. The whole gambit to add to the research and the information against the backdrop of the essential public health functions, and of course, the whole framework of the health system now in terms of assessment, policy development, resource allocation, access. All of those issues need to be taken into account, as well as the social participation and social mobilization needed in terms of the social capital that we need to get in terms of the responsible areas that need to be looked into. I rest my case. Thank you very much, sir.
Yes, what a case, what a case. Thank you very much, Dr. Graves. And I cannot attempt to say anything much on it. I mean, just to recognize, I mean, you've covered a plethora of issues: governance, the triumvirate between the Minister PS and the CMO, investment, public health, community health, primary health care, the model that is currently used, clinical over perhaps preventative health care, a range of things there, which is a very good segue to invite Dr. Hospitalis back to say, well, where do we go from here? What should be our priorities in this region?
Thank you, Governor. I'll start in a slightly philosophical way, since I am perhaps the longest serving public health official at this level on the panel anyway. I think our number one priority, sir, is to pause and to learn from this situation and see how the COVID pandemic is actually part of a bigger picture of the unraveling of creation, if you will. And then to act, to invest in human and social development, and to invest in a healthier planet and environment, because those are the two building blocks of your healthy economy. And work better together among ourselves in the region than we have ever worked before. We like to grumble and complain. We don't know how to work together as well as we could and we need to. And second, make more noise at global level than we ever made before. So that's my summation of the priority. Take the moment. Don't just think, oh, we're going to get over this and then back to business as usual. We will get over it. But if we go back to business as usual, we would have failed in what I think is the most important priority, to learn from this situation. And I'm speaking now with 30 years of experience and then reading and looking back over the previous couple of generations, because you asked me to start by looking at 100 years of pandemics. I guess the immediate priority is to get on top of this epidemic of COVID, continue with your prevention measures, with the vaccination programs, and getting those to levels where we achieve herd immunity. That's number one priority. Addressing vaccine hesitancy, which is playing at play. And that has to be, I'm getting my vaccine tomorrow. I have no hesitation in saying the vaccines are safe and effective. Of course, subject to whatever your local guidance would be. In terms of health broadly, not just these epidemics, but we have to focus on the commitments we've made with universal health coverage and on health security. We tend to ignore the public health functions. People clamor for the immediate things, the heart problems, the diabetes. So, and by the way, part of the recovering from COVID is to attend to the things that we've been neglecting. We perhaps attended to COVID, if you will, over as islands fairly well. I agree with Dr. Addix, but a lot of things got neglected. People with non-communicable diseases, also all sorts of problems, cancer that have been delayed. And so there's some treating with that needs to happen following as to people's health, people's travel, resumption of travel, resumption of job, all those are tied up. And they lend themselves as well to digital solutions. And here I would like to offer EarthMedic and some of our digital partners to look at how we can achieve a unified patient experience. And so again, we use the moment, not just to go back to before, but say, look, it would be really helpful if we had this and this. Folks have to evacuate St. Vincent now. It would be so brilliant if they had a mobile medical record that they had consent over and access to. So that when they have to flee with nothing in their hands, they can give somebody else authority elsewhere on the next island to retrieve their medical records. You know, when you have to leave immediately in a disaster, or an epidemic situation, somebody will often feed you and give you a place to sleep. But your medicines, you have to think about that beforehand, and it's great if you can access yours. So that's an example of a lot of stuff to be done immediately. In the medium to longer term, gosh. Again, building more on the universal health coverage and public health functions. I think because of our climate vulnerability, we have to look at the smart hospital programs that PAHO. We must get our health facilities resilient to face the climate challenges that are coming increasingly common. In the medium term, we have to find a way to align the climate action and investment with population health benefits. For example, leveraging built environments so that you can have more hiking, walking, with greening of urban environments. Triple benefit. Bottom line, energy security is benefit human health and the climate. So finding those places are some of the medium to longer term actions in transportation, and in the more longer term, food. We have to align better the health of the people, the health of the population we want with what we're feeding them. And it's a disaster at the moment in a way, because we have an increasingly obese population with more hypertension, diabetes, cancer, and that is connected to the climate and environmental story of how we feed ourselves on the planet. So I guess, in the more medium to longer term thinking, Governor, you're on the financial side of rebalancing our societies. The focus on the complete focus on money. It doesn't matter if people suffer, it doesn't matter if the environment suffers, and being dramatic. That is not getting us where we need. That is not sustainable, and we are paying the price. We have squeezed, we put our knee on the neck of the earth, if you will, for too long. And we have to pay, in the medium to longer term, we have to pay attention to that. So that's a panorama of some urgent stuff around the COVID vaccination program so that we can resume normal health activities, education, travel, jobs, and some of the medium to longer term urgencies that are really connected to the fact that we live in the Caribbean and climate change is accelerating.
Right. So thank you very much for that. And as you spoke, the song came, Mother Earth is crying, maybe it's bawling, and we're reaping the harvest. As they say, if you sow in the wind, you will reap the whirlwind. And perhaps that's what we're experiencing at this time. There's several things you mentioned, and I just want to pick up on a
Damian
couple.
Marley, not to cut you, Damian Marley has a song about that. Look at what they're doing to Mother Earth. Can't they see that she's hurt? Quite a good one. I recommend it.
There you go. All right. Well, let's check it out. It's a Caribbean brother speaking to our existential threat that is the climate crisis. So you mentioned a number of things, and very quickly, I just want to touch before I invite the panel back in to comment. You spoke about NCDs. I was sober, well, not shocked to be honest, because I know it's high, but quite distressed almost when I read recently that according to CARFA's 2020 report, NCDs account for 77% of deaths in our region. 77%. Almost 4 in 5 deaths in our region are attributed to NCDs. What do we mean? Cancer, obesity, diabetes, hypertension, heart disease. And that is up from 73% about 5-7 years ago. So the situation is actually getting worse. So that's very, very sobering. And as you said, the immediate focus priority needs to be to control COVID, but we have to keep our eyes or refocus as well very quickly to the NCDs and what is the havoc it's wreaking in our region. And it's going to be challenging because you make the point for investment, so does Dr. Graves, but after this COVID shock, as we like to call it in economics, there is probably going to be even less money to go around. How do we ensure that we really get the requisite investment and we get the right balance between, say, primary and curative care? To your point, and in fact, Dr. Radix and Dr. Graves, you made the point about digitalization. And I want to underscore that because as we look to find resources from our existing budget envelopes to apply into healthcare, we have to be smarter. And smarter means using digital means. To the extent that we do that, we can, in fact, generate additional resources for health. So a simple thing like the billing and admission system in our hospitals, which in many systems are still manual, still archaic. The insurers are not paying their fair share because our systems are not properly set up. So we should be getting additional resources there, we're not. The lack of healthcare records or the mobility and portability of these records. I have been on record as saying beyond the use of blockchain for digital currency, which is of course the current use case in action live in the ECCU, blockchain can be used to keep our health records and allow us to have that portability wherever we go, including after a hurricane, or as we see now in St. Vincent and Grenadines after a volcano. So I make this point to support you to say that when we speak about digitalization, very often I think people get lost in this idea of high-tech and job destruction and maybe some job creation without seeing the potential for a cross-cutting lift, cross-cutting sectoral lift, health, education, agriculture, fisheries, finance, all sectors of the economy, real and financial, if we adopt the right digital technologies. That is part of how we're going to find more resources for health. So I do want to underscore that. But let me go back to our distinguished panel and ask you to comment, having, a better understanding of our health priorities, given the last few minutes of our discussion. How can our region advance the issue of affordable and accessible access to quality health care? What are your views on that? What say you? And I could perhaps start with Dr. Radix, and then Dr. Graves, and then Dr. Hospitalis.
Okay, thank you, Governor Antoine. And I just want to take a moment to make a clarification, because I think after I spoke, reference was made to our strong systems. When I speak to our public health systems, I'm not necessarily speaking to our health care systems in terms of care, tertiary care, etc., but more of the population health type approaches, which I do believe we have a history of strength of in this region. So that's the things like vaccinations, going out to communities, controlling mosquitoes, looking at environments, etc. And we need to make sure that we hold on to those things alongside the lure, or not just lure, but what we see in terms of very sophisticated curative care, of which, frankly, with the size of many of our populations, we are unable to sustain and maintain in any kind of quality way. So I want to jump on your recommendation around digital innovation. This COVID pandemic has taught us we've done things digitally within a very short period of time that we've been planning to do for a long period of time. And the health system is no different in terms of how we've been handling care within the COVID pandemic. And we need to use what we're learning to be able to expand and reduce the cost with regards to the and increase the quality with regards to treating diseases at that level, which we must have and we must always have. And so we need to be able to do it differently, working together to pool resources and tapping on resources that are not physically in our space. I also wanted to say that we need to really focus on, we've been talking about investment. And what does investment mean? I'm not an economist, and so so I don't know the money side of things. But I do believe that the biggest export from our region are people. And I believe people are our greatest investment. And for the health system, it's no different. So we need to sit, reflect, look at our human resource, which are some of the most agile and multi-talented people, because they have to be within our small systems. And we need to be able to arrange our systems, not based on systems based on huge populations, but taking advantage of our small states and being innovative in the way we practice and deliver care. So that not necessarily taking wholesale solutions that have been created for a different context. And so I think I'll leave it there. But for me, those are the two big areas in terms of innovation and investment, both on the digital front and on our human resource front, really reimagining what our health workers look like, who they are, and what they do in order to ensure that we have a healthy population.
Right, thank you. And Dr. Alex, as you spoke, one other area that I'm sure you would agree with is the potential for telemedicine in our region to really help us access.
Absolutely. Telemedicine is, just to say, more than one person has spoken to the mobile health record, and I wanted to mention that this is something that we are already looking into piloting with one of our projects in the health unit at the OECS Commission that came out of the 2017 hurricanes. So we're looking to see if we might be able to use it now with the situation with persons moving in St. Vincent, or persons owning their health records in a way that's digital and can easily be accessed when they've had to move quickly from one space to the other. And I take your point about the blockchain technology, which can be used for this and for many other types of documents and things we need to begin to look at, especially as we begin to look at regional integration.
Right. Thanks for that. Very good. Dr. Graves, what say you? Just unmute your mic, Dr. Graves. Just unmute before you.
Basically, a lot has been said, and we spoke about telemedicine, AI, artificial intelligence, all of those things can come in. But I also believe that there is an inefficiency in how we budget for health. I also believe that you are intimately knowledgeable of the budgetary process for government, Governor.
Yes.
And I believe that when we look at the health budget, we have to begin to be more targeted. As far as I see it now, and using my experience from before as a Minister for Health, we have a scattershot approach. to the budget for health rather than a rifle shot approach. So we put in a lot of things. We say we're doing this, we're doing that, we're doing that, we're doing that, we're doing that. We do not look at the overall picture as far as I'm concerned. Maybe we are doing that a lot more these days, but we are not there yet. A more targeted approach within the confines of our framework, within the confines of the information we have before us. I mean, household surveys are sadly absent. So a lot of those things not on the periphery of that are important as part of the composition of your health planning and policy is absent. And then I'm saying, if you're looking at more affordable and equitable health, you have to see it as being inextricably linked to the elements of what I call universal access to healthcare. So there has to be the increased and more effective community service, the health checks and awareness. All of that is part of the gambit. Health checks and awareness in schools, in communities, increased community facilities to stimulate exercise and other recreational activities like sport and so on. And all of those things will come in. Your special concessions for certain targeted areas. These are the things that we have to look at. So we have to be a lot more innovative, more rifle shot in terms of our approach and strategy rather than the scatter shot. And basically, against the backdrop of the framework for public health and the essential public health functions, we should be able to have a better approach towards the budgeting for health. It cannot be like we do for other budgets or for other aspects of government. Right. I believe that we need to begin to rethink in that way, and COVID-19 has indeed brought that home.
Right. Thank you. Thank you, Dr. Graves. I wish we had more time, because once you get started on budget, you and I could go down that alley for a little while. Yeah, I have some views as well as a former financial secretary. But we leave it there for the moment. I hear you. I mean, you're the Minister of Health. You have a perspective, and I appreciate that. Dr. Hospitalis, what say you?
Thank you, Governor. Well, I think in terms of accessible, affordable, and I'll comment in two ways. One is on healthcare services themselves, and the other is on what Damien has been talking about, the supportive environment, the public health goods that we need, and where do you get the investment for those. We also talked about quality, so doing the right thing right is the shortest definition of quality I know. Colleen mentioned, Dr. X mentioned, we have a mix, a diversity of not only of countries, but of the people who work in our health systems. So that's a part of how you have to think about, how you achieve the accessibility. I think a big priority is we need to be much more participatory and listen to and engage people and communities. What WHO sometimes or other authors call the seventh pillar. And there are the 6 pillars that Damien referred to earlier, and the 7th pillar is often, the community, the student at home who has a smartphone and can help with granny's diabetes and so on. And also that group can help to pull in information that we don't currently have. So again, the digital piece is there. I think we're small countries, so definitely to have accessibility and affordability, both for clinical healthcare goods, but also pharmaceuticals, diagnostics, public health goods like rapid testing and so on. You need to come together, which we do, but we could do better. So you have the PPS, you have the CRS and CARFA that help to make they're beginning to, and a lot more can be done in that. That, Tim, is something that should be ramped up. The focus on getting the essential medicines more affordable, pooling, procurement, having discussions with distributors, manufacturers. Some of the drugs are very expensive, and you need to have broad discussions with people to get access to what is deemed an essential product. So prepayment, pooling, but we have to stick to it if we say we're going to do that. You can't say you're going to fund PPS in one way or you're going to fund CARFA. I used to head that up, and for years you don't give any budget support. Then you can't expect a starving institution to respond in a timely way to be, especially when there's another public health challenge. I will perhaps finish by, well, 2 things. One, at the regional level, it's not only like the CARFA, but you have that whole cluster with SEDIMA, with impacts, that look at crime, security, and your public health emergencies as a package because they're often connected, and how do they work better together. I think following the money is important. I've attended 3 or 4 of the national conferences on national health financing put on by the Health Econ Unit. And I'm struck by how much the social security systems are under pressure because of NCDs and because of the demographic shift. And those folks are waking up to that. So it's timely to have dialogue about how can you create financial incentives and nudges in that system for the healthier behaviors, which will make healthier people and less cost, but also reduce some of your climate impact if people are eating a more plant-based diet, if they're using alternative transportation modalities like biking and walking. So those are, I think, some of the things that help to guide as we think about accessibility and affordability that you need to bear in mind, both the care itself and the cost of medications and diagnostics, the training and preparation of professionals. How do you get the community more engaged, participatory, and that's where that digital health piece comes in. Let me finish by saying something on the digital side. Of the 10 biggest mobile phone operators in the region, guess how many of them have invested in health programs? Sorry, of the 10 biggest mobile phone operators in the world, guess how many have invested in health programs?
Tell us.
All 10. All 10. All 10. Orange, AT&T, Verizon, they are all investing in health, not from public good purposes, but for the purpose of how can they create a market. So if we don't look sharp in about 5 to 10 years' time, we'll wake up and Google will control digital health for profit motive, not for public good motive. I think we're at a stage where you can still have innovative and big projects that bring them to the table and they work with you, rather than as we are at the moment, really very, very vulnerable. That's a global picture, but I think it's playing out here in the region. So I've said a lot of things there, but the last point was around following the money and working with the payers to tweak our system to get behaviors that are healthier and more sustainable from a planetary point of view.
Right. Thank you very much, Dr. Hospitalis. And you kind of teased the subject of data colonialism when you mentioned who will control our digital health in a few years' time. Maybe that will be the subject of another dialogue. Before we pivot to the poll, which we will do in a minute, I just want to paint a scenario which I'm seeing right now. So by the way, I have been vaccinated, and in fact, I will be receiving my second dose very soon. I think early May is my next date, my appointment. I continue to make the point that while vaccines are ultimately it's a personal choice, in terms of economic recovery in this region, we have to be very clear. It is critical to our economic recovery. We're now seeing a situation where the US, for example, is putting out no travel advisories because of what they perceive as high-risk countries. And in part, that is based on vaccination rates and whether or not countries have attained herd immunity. It's so ironic because having managed this COVID-19 pandemic so well, better than most, certainly than the larger economies until some of them finally got their act together in recent times, we now face a real prospect that we could find ourselves on the sharp end where we are not getting visitors or the flow that we should expect because we are now perceived, some of our countries, to be high risk. Because as we know, both the United States and the UK have really ramped up their vaccination programs, and they know, well advanced. And they are now in the UK over 33 million, in the United States over 200 million people have at least received one dose. And so we have to be very careful about that. You touched on, one of you, I think it was Dr. Hospitalis, the issue of vaccine hesitancy. And I will simply say this before we take the poll. So we have a situation in our region where some people are hesitant. They are watching the science, as they say. But some of these same people, I observe, are buying ultra-processed foods. I'll give a simple example, a bag of chips. They are not reading the label. They're not seeing whether it's trans fat, whether it's fructose, what is in the contents. They are eating it to their heart's content. And in those moments, I don't hear any discussion about science or about health. Perhaps they're doing that because it is cheap, relatively speaking, which creates the nexus between our food and nutrition and, of course, our health. And that's a huge issue right there with macroeconomic implications. But there's an irony that I observe. People are cautious about vaccine, as is their right to be. I want to be clear. But at the same time, will, without thinking almost, consume these ultra-processed foods to their detriment. And if you don't believe me, just look at the CARPHA report, which shows that 4 in 5 deaths in our region, almost 4 in 5, 77%, are NCDs. Obesity, diabetes, hypertension, cancer, and the like. So it's a moment where I think we need to have clarity, and we need to, as a region, really focus now on what is really, really important and get it right. Having said all of that, I want to encourage people to consider and consent to taking their vaccines. Now to the poll. So as we indicated earlier, our poll is via the mentimeter.com. We're going to take the questions in a minute. If you're joining us now, you are listening to ECCB Digital Dialogues. Our topic today is pandemic and health care. On our panel are Dr. James Hospitalis, Dr. Carleen Radix, and Dr. Damian Graves. We are about to enter our second segment, which is our audience poll. And then after that, we're going to go to our questions and answers. www.menti.com, that's the access. And then the code is 50351947. Let's check out the responses so far. So we're doing a check-in now. Let's see how we're doing. Question number 1. From a personal standpoint, what is your main concern about health care? From a personal standpoint, what is your main concern about health care? There are 3 options. 43% of persons who have responded so far, now 50% say it's the quality of care, quality of services and health care. 25% says it's cost, it's just too expensive. And 25% say it's access to the range of services. The range is not broad or wide enough. So the predominant concern coming through from this first question is the quality of services and care. And as we speak, that number is now going up to 63% of respondents. So that's the takeaway for the moment. The poll is live and continuing. Let's go to our next question. So it's a check-in. Second question is, what reforms would you most like to see in our region's healthcare systems? What reforms would you most like to see in our region's healthcare systems? And 38% of you say the modernization of the systems, the modernization of the health facilities. That's now 45% of respondents. Then 18% says implementation of universal health insurance, strengthening of primary health care, and introduction of telemedicine. So it's, again, the overwhelming majority of persons who've responded are saying we need to modernize our health facilities, we have to invest in them, and then almost a dead heat on strengthening primary health care, 17%, implementing health insurance, 17%, and introduction of telemedicine, that is now 14%. So there you have it. It's an indication of those of you who have polled. At ECCB, we always say feedback is a gift, so we want to hear from you. And when we think about public policy and even advising on public policy, your feedback is important, a very important input in helping us to shape public policy, and as important data points for us to bring our advice to the table. Our third question, please. Third question reads, apart from the current COVID-19 pandemic, what do you perceive as the single biggest threat to health and safety in the Caribbean? Apart from the current COVID-19 pandemic, what do you perceive as the single biggest threat to health and safety in the Caribbean? Well, it's an overwhelming 100% so far say it's NCDs. NCDs. And by the way, that CARPHA report which we referred to, that shows that almost 4 in 5 deaths are from NCDs, non-communicable diseases, cancer, cardiovascular, hypertension, diabetes. The largest risk factor identified by CARPHA is, in fact, our diet. The largest risk factor, identified by CARPHA is our diet. So there we have it. There's a slight shift. 94% say NCDs, 6% say violence. But the overwhelming majority of respondents so far are indicating that it's NCDs. Let me just say thank you, Dr. Hospitalis, for your service, especially as the inaugural head of CARPHA. And of course, I now want to recognize the current head, Dr. Joyce and John, and the team. And you made a point that we have not invested enough in CARPHA, but we are now seeing in this pandemic how reliant we are on CARPHA and how important that organization has been to our regional response. And maybe that will encourage even more investment in CARPHA going forward. So again, thank you. And again, to the current CARPHA team, we want to just acknowledge your very important role in our regional response to this pandemic. So that's question number 3. Do we have a 4th question? If we do, let's take question number 4. Do we have a 4th? We don't? That's it? Okay. So those are our 3 questions. The panel can weigh in on that in a minute if they wish when we get into the Q&A, which we will do now. So again, we're at the top of the hour. If you joining us for the first time today, you are listening to ECCB Digital Dialogues. Our focus today is pandemic and healthcare. Our distinguished panel members are Dr. James Hospitalis, founder of Earth Medic Foundation, Dr. Carleen Radix, head of the OECS social division, and Dr. Damien Graves, who is professor at the St. George's University. Those are our panelists, and we are very grateful for their expertise today. Let's go to the Q&A, and we will start the questions, and then we could perhaps come back on the audience poll. Dr. Hospitalis, the first question is for you. You referred to the aging global population as one of the forces that require consideration in the context of emerging and future pandemics. Have we given sufficient thought to this issue from the perspective of Caribbean societies, particularly those in the diaspora who are desirous of retiring in their home countries? Have we given sufficient attention to public health, social planning, and re-engineering for our aging populations? Dr. Hospitalis, can you take a go at that one?
Thank you, Governor. I think our societies have a certain degree of ageism built into them. Certainly having crossed 60, I see that people, the structures in our society are not necessarily age-friendly. So this, and this is an important point that you're bringing, how to facilitate that side of it. An example, we had an auntie here going to a home for the elderly. Trinidad and Tobago has discovered about 150 such homes, and they are very cut off. And with the COVID regulations, it means some people who are resident in homes for the elderly don't see their loved ones for weeks, for months, for the whole year. And the place has no phone, no digital connectivity, nowhere you could do a Zoom or anything like that. So old folks don't count. But old folks do count because they can vote, and there are ways in which you can bring them in more. And as the population ages, the biggest, for many years, the Caribbean, as many other parts of the world, had a very large young population. But the most rapidly expanding part of the population in most of the countries is population over 60. And we're getting to the point in society where the people who are over 40 will outnumber the people under 40, which will be the first time that's happened. So I think more consideration, in short, has to be given to your older generation who have a lot of wisdom, a lot of experience that can help with some of the current challenges that we face. So that's a general sort of answer. I guess the question was framed more broadly on facilitating retirement back to the region.
Yes, having our people in the diaspora return comfortably and I guess safely
right.
to our region.
Right.
Yes.
That's an interesting one. I mean, they want somewhere safe, secure, free from fear that if something bad's going to happen, and if something does happen, then the system is set up to respond and support you with your health problem. I mean, in the broadest terms, we have reasonable health systems, but we also have a lot of gaps still, and you have the constant problems of out-migration to deal with when you're delivering quality health. And public health goes beyond just a health access facility: water, food safety, traffic safety, other dimensions of well-being in an environment. Again, I think some of the climate actions that are recommended will bring immediate health benefits to populations, reduce some of the traffic safety and other risks, make it a friendlier environment for living in, and therefore hopefully more attractive to your retiring diaspora.
Right, thank you. Let me just interject. I think they may not want to come in, and that's fine, but let me just interject from an economic standpoint. So beyond the care of our people who want to return home, retirees, which of course we want them to come back. From an economic standpoint, the care economy is one of the fastest growth segments in the world today. So if we're thinking about how we grow these economies, how we diversify our economies, we will do well as a region to position ourselves to be able to deliver care to this aging population, many of whom coming back have the disposable income, either retirement savings or insurance or a combination of both, to live comfortably. But their concern is about adequacy of healthcare arrangements on the ground. My hope is that the pandemic experience of telemedicine, where they had to receive a lot of their consultations from their homes, might give them a little bit more comfort about the viability of that modality for them to receive quality health care back in our region, back in their own homes. They've built lovely homes, they want to come home. They ought to be able to enjoy their homes and have that access. Now, of course, if there's an emergency, there has to be a response on the ground, and that is where we have to make sure the arrangements work for them. But I just want to make the point, beyond caring for them, they are our citizens. They have served, they have worked hard, they've sent remittances, they want to come back to the lands of their birth. There is an economic opportunity, is the point I'm making, for this rapidly growing care economy, and our region needs to be positioned to take advantage of that. Dr. Graves, you wanted to comment, please.
Yes, Governor, I mean, the three polls, the poll you conducted there, quality of services, modernization of health facilities, the single biggest threat, all of that can be wrapped up into one in dealing with this matter. But I want to change the focus from basically the individuals in the diaspora coming down and wanting to access those services. I want to shift home base a little bit. And here's the problem we have. Although we are now saying that 60 is the new 40, because people seem to be living longer and so on, but we also have to deal with the area of population senescence. As long as, once you have a situation of 7% of your population being over 65 and over, you have reached, in demographic terms, the limits in terms of population senescence. And we know that that is growing. But here's the point I have.
Sorry, can you just take that again? Population. I want to make sure we heard you clearly. Population what?
Population senescence.
Okay.
Population senescence. So here's the situation. Here's an old lady living in your home territory, Governor, Grenada, but living in Tivoli.
Yes.
Okay, just an example. And that old lady lives on her own because her loved one, her children are overseas, her loved one has passed. She has multiple morbidities. She could be diabetic, she's poor, basically, just looking at that, but let's look at the multiple morbidities. She could be diabetic, she could have hypertension, she could be asthmatic, and have other conditions as well. So multiple morbidities. Here's the second thing. She could be living in a home that is not so wholesome, that is not properly ventilated. But here's the situation. The community nurse visits this old lady and says, okay, I'll give you this, I'll give you that, I'll take care of you. But unfortunately, I cannot deal with your housing condition or with your welfare condition. So I will advise you to go to the Ministry of Social Development. And that's the problem we have. Why can't we have a one-stop shop? Why can't we have an integration of services per se? Why can't we have that nurse or that social development officer coming into there and saying, yes, I understand that, so let me take care of your business, instead of referring this lady, or even if she goes to the office of the Ministry of Health or Welfare or whatever it is, she's referred to other places. Why can't we begin to have a mindset of integration of these services? And when I say integration of these services, I'm talking about a mindset. I'm not talking about a means to an end.
Yes.
I'm not talking about integration in order to give you these kinds of. I'm talking about a mindset that we need to begin to nurture within the public service, as well as the private sector, as well as CSOs, that we understand that when our people come, there should be a one-stop. What is preventing us, Governor, from having an integration of these services for the comfort of our loving senior citizens?
Right. And sometimes it's simple as a lack of a sense of imagination. Sometimes that is all it is in our region. And I say this with great respect.
It's the same that's needed for our residents as needed for people who are diaspora.
Yes.
Because we all move all the time. If you're in a little village, you got to go to town. If it's a bigger problem, you got to go to Barbados or Martinique or Trinidad. And it may be that you reside in the States or England for 6 months a year and 6 months out here. So you have to start I think the answer to Damien's question is you have to start at the level of the person and the patient, and construct build with a unified patient journey in mind.
Right.
And start small. Anyway you pick. And then with what you have in the Eastern Caribbean, you then have the ingredients for proving that this can happen and serve your residents and serve this tourism economic piece that we need to, and make it not just tourism, as you said, these folks are from here. We should facilitate coming back.
Yes, and of course, Dr. Radix, yes, and by the way, Dr. Radix is the head of the Human and Social Division. I was missing the human a little while ago.
That's okay, and we often miss the human,
yes.
Governor. And I just wanted to come in a bit here on the issue of older persons and aging. We have a new program director for health who's very passionate about aging, Dr. Bamudu, and mentioning her here. I would be remiss of me not to say a couple of things around the economic opportunity, not just in care, but from the human point of view. Yes. With our older population, we're missing an economic opportunity.
Yes.
Because we've somehow created this arbitrary number of 60 or 65 or that yes. existed some long time ago that we measure and we indicate. Now, I'm not saying that they're not vulnerable persons like the scenario that was described that need services, and certainly that is something we have to address. But what is the untapped opportunity that we have with our older persons and that population? And how do we look at keeping that population healthy, creating the environment that helps with our economy by incorporating more of our people? I just wanted to make sure I bring that to the fore.
Right. No, we have to take care of the elderly and do it in a very clear, strategic way. By the way, I just recall a conversation I had with a distinguished QC a few months ago, and he said to me, as a lawyer, we peak at 65. We peak at 65. Unfortunately, in our region, we retire people too early, way too early, which goes against the science. Because if people are living longer, then we shouldn't be writing them off so early.
Tim, I am enjoying my on-call career.
Oh, there you go. But it's a wonderful opportunity, and we need to address that. So, in answering this first question, you also answered the second from Facebook, which is about the major hindrance to better access to health care. Perhaps you could spend a moment talking about how could we better partner public and private? Because when we talk about this lack of investment in health care, very often the focus is on the government's not doing enough. The government needs to do more. But could we explore for a minute how we could better pursue public-private partnerships to bring to the table some of the the resources that are required. You know, Dr. Hospitalis, you are the founder of Earth Medic and Earth Nurse Foundation. I finally got it right. So you or any one of the panelists, how do we bring public and private together?
May I just say, first of all,
Yes.
Governor, first of all, we have to remove the trust deficit between private and public. That is an overarching thing that has bedeviled our existence for a long time. So our private doctors, for example, who have set up shop in terms of dealing with patients and so on, have it's almost like an epidemic in terms of that kind of distrust of the public sector, and the public sector too has a distrust of the private sector. So here's the situation of the sharing of information. Maybe that is improving now, but not sufficient at a sufficiently rapid rate as I would like to see it happening. Yeah. So you have information in the private sector, but you do not give that information to the public sector, sometimes under the guise of confidentiality, patient confidentiality and so on. So they have been operating at odds. They have been operating at cross purposes instead of the integration. So sometimes your national health statistics is severely lacking because you don't have the authentic private sector providing those kinds of statistics to give you a better picture for planning purposes, for national health planning, national health policy purposes. So my first, and I'll add to that a little later after my fellow panelists have come in, but I think the first order of business, if you want to get this going, we have to find a way to remove the trust deficit between the two.
Okay.
Thank you.
Thank you. Who else would like to comment on this one? Dr. Radix and then Dr. Hospitalis.
Okay, are you hearing me? Because
Yes.
I've been getting messages
Yes.
that the
hearing
sound is low.
We are
okay,
hearing.
so I'll try to keep the mic a bit close. I think maybe I'm going to just be a bit philosophical and not get to the sort of nitty-gritty of the private-public encounter. But what I will say is this, especially in our context, that when we're looking at health, which is everybody's business, there used to be the slogan in Grenada that tourism is everybody's business, and there is a slogan in St. Vincent right now about health being a shared responsibility. But health is really all of our business, and so I think in our context, at least at the beginning of the idea of what we want from health, needs to include everyone in the conversation. So public, private, etc. And if we're able to sort of set collectively what it is we want for our population, what we want for our mother, our daughter, our son, then we can begin to fashion relationships,
yes,
maybe with a greater level of trust that can really impact the issues at hand. So I think I'll just keep it at that philosophical level. Because when 77% of our deaths are due to NCDs, all sectors are affected.
Right. Very important point, because what you are calling for is an all-of-society approach to health care, which we have tried very much to deploy with respect to the pandemic. And, I'm hoping in all of this difficulty, this very difficult season for our region, that there will be some legacies from the pandemic, one of which will, of course, be the need for that all-of-society approach that you've just espoused, Dr. Radix, in the way we go forward with healthcare. So I thank you for that intervention. And just to add on public-private sector, and I'm addressing a question that in the Q&A box. The question was about public and private, so you spoke to that. And how do we support, for example, local food and beverage sector? And my mind went again to the food and nutrition security discussion. How do we support our local food and beverage sector, our farmers, our fishers, to be able to bring to table healthy foods that will assist us in addressing this crisis, this epidemic that is NCDs in our region? Any additional thoughts on that?
Well, one thing, if I can jump in, Governor, and it ties to the question about partnership with the private sector, is in the area of food and in the area of labeling and consumer empowerment. We heard about NCDs, how important that is, and that food is a major driver. I would also say inactivity. I'll come back to that.
Yes.
But we need to look, as Dr. Radix was saying, not only at public-private, but I would talk about 4 Ps: public, private, people, and planet.
Right.
Public, private, people, planet partnerships. And there are things that we can do to move to more plant-based diets, less red meat and processed meat. But we should also clearly label what is unhealthy. And that's what we're not doing. Before I left CARFO, we prepared a 6-point policy package, which was adopted by CARICOM. The number 1 policy lever is front of package labeling for foods that are high in salt, fat, sugar, or overall calories. You're not trying to be red, green, yellow, or any other color code. It's a simple stop sign sort of warning. Stop. This food contains high salt, fat, sugar, or calories based on the Power Food Nutrient Standards. And it gives the consumer something to look at and make a decision then about on the healthfulness of the food. And such foods may not be in schools, and such foods may not be marketed to children, which are 2 other aspects of the policy package. So this is a compliance-based partnership issue. As soon as you put that policy in place, they will be lining up to show how they are reformulating products and how they are becoming healthier. That is how you do that partnership, I think, with the food and beverage sector, at least that part of it that is contributing to the problem. I think for built environment, there's a lot of possibility to partner with private sector, developers, existing local authorities, and sports. We have so much existing savannas and stadiums and roads. We can do a lot to make alternative transport easier and tie in the private sector. 2 other categories. One is insurance, especially risk insurance. When you look at World Economic Forum global risk report for this year, climate inaction is the number 1 risk that they see for the whole world. So if we talk to corporate entities in the Caribbean about their policies on climate as an enterprise risk management issue and engage the boards of corporations, and especially insurance companies, that gets the discussion going. And you may say, where am I going with this? Well, as soon as you start to ask that question of a corporate board, and they ask the company CEO, well, what are we actually doing? One of the things they will have to do is to start getting healthier workplaces, healthier food, supporting people to bike and walk to work. So you immediately serve a health agenda as well. And then the last are the digital partners. There's enormous scope. I already told you, the 10 biggest telecom operators in the world are investing billions in health. Call them to the table. Call Digicel, call Cable and Wireless and say, what can we do together? How can you, these are some of the things we're wrestling with. And I think they're ready. We'll be putting on a workshop with mobile operators in the near future. It'll be global, but I keep advocating to use the Caribbean to work with the Caribbean as a demonstration site because of the institutions and partners here. So that's food and nutrition, that's people's movement, transport, that's insurance and the financial sector. Sagicor and Guardian Life are hemorrhaging because of NCDs. They could easily finance from the savings of a program, a sustained region-wide education program on NCDs and wellness, which has been called for more than once by the Council of Health Ministers, but nobody has stepped up to put the money in it. That's a regional public good. The spend is not a lot compared to a few CAT scans and a few high-end bypass surgeries, but the impact would be tremendous.
Right, thanks for that. And just
if I may jump in here
hold
a
on,
little bit.
I'm coming to you because I'm going to give everybody a minute for their final comments. So, Dr. Grave, just stick a pin. I just wanted to say very quickly, make that connection. When you mentioned the insurers are hemorrhaging, the point is that because of NCDs, premiums keep going up. And our people need to appreciate, make that connection. We complain about premiums. And of course, we want to see them stay low or relatively low. But once NCDs keeps rising the way they are, there's a knock-on effect in respect of premiums charged by insurance companies for health plans. And we have to make that connection. In other words, if we want to bend that curve down in respect of costs for insurance, health insurance, primary health care, controlling NCDs is a vital part of that. Let's get to our closing round. Dr. Graves, we'll start with you.
Okay, so I have to change what I wanted to say because this is the closing round. I know I just have 1 minute. But I think that my mind is, uppermost in my mind is the whole business of the resilience of health systems or strengthening health systems and so on. And I think that COVID-19 has taught us what is not normal in what we considered normal before COVID-19. And therefore, I think the lessons that we can learn from all of this for our health systems is the recognition of what I call the global nature of health crises and the need to clarify roles across the broad spectrum of actors at all levels of the global system, including within our countries. Another precondition is the legal and policy foundations that we must use to guide our responses and establish a certain amount of accountability and transparency as well. But also the strong and committed health workforce that we need in terms of what I call building social capital, a sense of worth and community responsibility among health actors. And I agree with you that all hands on deck, Colleen. Dr. Radix said all hands on deck, and I agree with that. But what we need, therefore, going forward is up-to-date information, a sense of diversity in addressing the issues, self-regulation, the integration that I spoke of before, but also the adaptive ability. In other words, to transform in new ways, to improve the function of our health systems, not only in time of crisis, but in normal times.
Right. Thank you very much, Dr. Graves. Dr. Radix, please.
Thank you, Governor. First of all, let me just say thank you for being a part of this very relevant discussion around transforming our healthcare into strong and resilient systems. And so I want to just repeat or echo a couple of things, what we've learned from the pandemic. One is that we need to make systems we need to strengthen our systems in ways that work for our context and our people. And our context including size, and our people, including culture and economies. And so learning from the pandemic, the use of digital technology, and you've made the emphasis on telemedicine and how that can impact and transform our systems. And of course, the use of our people, how our agility in terms of having the right mix of human resources to transform the way in which we deliver health. I think people transform things. But I also think the discussion went to not just transforming healthcare, but transforming our health as a population. And I think this has to be our North Star, transforming our health. What do we want to see shift to transform our health? And if we start with that, everyone, public, private, etc., can begin to adjust. There's a terminology used in the environmental sector about just transitioning, and transitioning from old energy means to when you're doing greening and adjusting jobs accordingly. And it's the same thing if we talk about the private sector and the food and beverage industry. They need to go through a transitioning. We're not saying that we need to get rid of things. We all need to eat and drink. But if we know that we want the North Star of a healthy population, all of us have to get on board and make the shifts that we need to make to transform the lives of our people. So I think I'll leave it there.
Thank you. Thank you very much, Dr. Radix. Dr. Hospitalis?
Thanks, Governor. Well, closing remarks. I think since we're on the subject of pandemics, we've seen a dozen or so in the last 100 years. They seem to be increasing in frequency. We're going to see more of them for reasons outlined. And so the preparation as small islands, especially in terms of the healthcare systems that you have and the public health security that you invest in, will be important, especially given our dependence on travel and tourism. Where are we going in the long term with travel and tourism, asking people to spend 2 or 3 tons of carbon to come and visit us? I'm not sure, but that's a different discussion. I think more and more climate will become the dominant force, the dominant thing in our societies. And so, respecting our other mother. Today is Earth Day. Earlier today, I was planting some trees for food with a local community. And so paying attention to that would be, and investing in that. So that the only way we're going to have a healthy population long term is to have a healthy planet and environment. And so readjusting that balance longer term would be important.
Right. Thank you, Dr. Hospitalis. Public, private, people, planet. All of society approach. It's been a real pleasure, and we're grateful to all of our panelists, Dr. James Hospitalis, Dr. Carleen Radix, Dr. Damian Graves, for sharing your time and expertise and your passion, it came through, on this very important subject of healthcare. On behalf of the ECCB, I wish to thank you again for making yourselves available, and obviously we must continue this important conversation. Before we go, let me also thank all of our participants who joined us in the Zoom room, on Facebook, and all of our partner broadcast stations, radio and television, which facilitated the broadcast today. Finally, I'd like to thank our ECCB team, Dr. Emma Fasordo, who is the coordinator of the series, and she works out of the governor's office, Shermalan Kirby, Karina Phillips Summersall, Shana Daniel, Mr. St. Alston Crawford, Mr. Keith Finch, Mrs. Monique Frank, Elizabeth Whalen, Janelle Brathwaite, Lyndon Jacosel, and any other colleague who I did not mention by name whose work today, I give you my thanks. Finally, in closing, I was advised a few minutes ago that there was another eruption of the volcano in St. Vincent and the Grenadines. And so, again, our prayers, thoughts, hearts go out to our brothers and sisters, and we stand strong with them in solidarity, not just in prayers, but in also practical support. I can tell you the ECCB has already transferred $1 million, having been approved by the Monetary Council. That was done yesterday. And there are several other areas in which we're helping, and of course, those are going to be spoken of in due course. And I want to conclude by encouraging us to draw on our faith and fortify our minds in this period. 2 Corinthians chapter 4, verses 18 and 9. We are hard pressed on every side, but not crushed. Perplexed, but not in despair. Persecuted, but not abandoned. Struck down, but not destroyed. I don't know about you, but that scripture has been a tremendous source of encouragement and comfort to me over the many years in public life, in hardships such as we have now, and I commend it to you. Thank you very much, everyone, for joining us. God bless you all.